Okay, I'd like to call the Thursday, September 1st, 2022 Health Committee meeting to order. We have 4 members present, so we do have a quorum. We have minutes to approve from July 14th of our special stand-up meeting and August 4th, 2022 of our regular meeting. Do I have a motion? Motion by Beer, second by Bell. Any additions or corrections? Okay, hearing none, all in favor, and I think the chairman has to vote, so aye. Any opposed? Okay. Do we have any members of the public?
Chair Schaefer, we do not.
Thank you. Moving on to departmental matters, we have Jason Tabb from Juvenile Detention, Diane Hughes from the jail superintendent, and Shannon Miller, I don't know what her title was.
She is the regional.
Yeah, you guys can all come up at the same time.
Just sit here at the end, and then the bottom right button turns the mic on if you have to answer any questions.
Okay, we have 3 items for action here. First one is request approval of a mobile imaging services agreement with Biotech X-Ray Incorporated for jail medical. Motion by Beer, second by Martin. And that's on pages 3 through 6. Who wants to say something about that? Anybody? If not, Ms. Taylor May.
So this contract would be with an outside mobile imaging services company. So instead of us trying to transport people that might be in need of an X-ray out of the jail, that they would come to us, in simple terms. And so that would be a cost savings to the county in not only overtime for COs to have to attend to those people off-site and the transport time, but we also feel like it would provide greater comfort with any kind of break or sprain or injury that would require an X-ray in not having to be transported in a car if they can come to them.
Any questions? Hearing none, all in favor? Aye. Any opposed? None, so that is approved. The second is request approval of First Amendment to the agreement for the provision of health care to incarcerated patients with advanced correctional health care incorporated on pages 7 and 8 of your packet. Do I have a motion? Motion by Beer, second by Bell. Who would like to talk about that one?
I would just like to express that this is a correction to our previous ACH contract. The first agreement was calculated with 168 hours. That should have reflected 208 hours, which would include our health services administrator, who is at the back of the room today. Taylor is our new health services administrator. Just started today. And so we'd like to provide for that. That was the original intent of the proposal.
Any questions? No. All in favor? Aye. Any opposed? None. Okay, that one gets approved. And last is request approval of a memo of understanding for counseling services, McLean County Juvenile Detention Center. And a motion by Beer, second by Martin. And this is an addition, is that correct?
This would be a substitute for when our regular therapist is not available, either on vacation or leave or emergency. This person would be brought in her absence.
Okay. Anybody have any other questions? Hearing none, all in favor? Aye. Aye. Any opposed? And that one is approved. We have the Jdc Monthly Report. Is there anything you'd like to comment on that, Mr. Tabb?
I don't believe so. I think it's pretty standard going along with the ones prior, but I'd be happy to answer any questions.
Any questions on JDC report? Okay, and then we also have the jail medical report that everybody should have received. Is this almost?
Did they receive it?
I got it.
Okay. Okay.
I think Ms. Morlock sent it to all of us.
Oh, okay. We made copies. We weren't sure.
Yeah, and so I printed mine. So this is pretty much the way it was before. Is that correct?
It is. That's correct. If you'll notice, though, some of the items for year-to-date are not on there because during the transition in June, those numbers were not captured. So I didn't want to put year-to-date when they were going to be skewed. And then the numbers that we keep in the jail side, which is included in this, like the transports, I was able to provide the year-to-date.
Does anyone have any questions on this report? I think that this is still a work in progress, so it may be different next month or in the future.
Yes, ACH does have their own formats and ways that they keep statistics, so down the road, it will be probably looking a little bit different and maybe more informative to the committee as well.
Okay. Anybody have any questions, comments? Okay. Hearing none. Thank you. Next up, Tim Wiley is Nursing Home Administrator. You have 4 items for action today. The first item is request approval of provider agreement and business associate agreement with Aria Care Partners for dental services on pages 18 through 30. A motion? Motion by Beer, second by Martin. This is a new service. Do you want to explain that?
This is a service that, according to my understanding, was in place prior. This company was originally known as Senior Dental, and then my understanding is that the home discontinued that service for some reason. I'm not really certain as to the reason, but this organization would provide dental care to the residents at no expense to the nursing home or to the county. It's just they come and provide on-site dental care, actually fairly comprehensive dental care for the residents.
So can I ask why it doesn't cost anything?
They're able to bill Medicare or Medicaid
Okay.
or the resident's insurance.
Okay, and then they just accept whatever that payment is? Okay. Anybody else have any questions? Pardon? Do a lot of residents need a lot of dental care?
It's not uncommon, especially when you have breakage of partials or dentures, things of that nature, or someone needing, some actually are needing dentures at that time. I've used this organization in the past. They're pretty well-known in the industry as a common provider around here.
Okay. No other questions? All in favor? Aye. Aye. Any opposed? None. That one is approved. Excuse me. Next item is request approval of clinical services agreement and business associate agreement with Bespoke Psychiatry on pages 31 through 53. Motion by Beer, second by Bell. I'll let you talk about this one.
Upon my arrival, we had an agreement with another psychiatry provider who since has stopped serving or providing care in this area. So we were able to start up conversation with Bespoke again. They will be billing Medicare, Medicaid for their services. It's not requisite, but strongly recommended that we have a psychiatric partner. They will help the residents with issues including in trauma-informed care, which is a new regulation that I'm actually excited about. Secondly, they'll help us monitor our psychotropic and antipsychotic use.
Anybody have any questions? Is anybody on your staff part of the trauma-informed group for the county?
No,
Might have to make a connection there.
I would like that.
Yeah, I will take care of that. Make a note, Susan. Okay, anything else? If not, all in favor? Aye. Any opposed? None, and that one is approved. Request approval of a business associate agreement with LTC Consulting Services. Talking about psychiatry, I'm thinking of counseling. Consulting Services on pages 54 through 63. Oh, motion by Beer, second by Bell.
So this is a consulting service recommended to us by Larry Templin, who's helping us with our receivables and aging. This company will provide for us collection services, not private pay collections. We should be able to do that in-house, but their forte is going after government agencies, insurance agencies, things of that nature, who sometimes can be difficult when it comes to collections. So they'll be able to help us. It's a strong value add.
Are they going to go back? How many years are they going to go back? Are they going to really try and go back all that way from several years ago?
If we're able to get them on board, Larry and LTC and I will collaborate to clean up our collections and determine not only how far back we can go, but how much we actually are owed. I know our aging number looks extremely high, but in full transparency, I'm not even confident we have all that coming. So we're going to clean up all of the AR and the aging and see what we're truly owed, because there are a lot of credits in there, and some of those may offset some of what appear to be receivables, and they will help us with that, and then they will help us going forward.
Great, that'll really help the bottom line, I think. So, anybody else have any questions? Member Martin?
I was just wondering if you'd talk to legal as far as knowing how far back you can go to collect. Has that ever come up?
I've not had formal conversation with them at this point. I feel like we need to find out what we actually owe whom, and then I'd be happy to consult with them on that. They would probably advise primarily on private pay collections.
Member Bell?
I really want that looked into, how far you're gonna go back, because I'm thinking like maybe 7 years is a little bit much, but
Yeah.
3 years maybe is doable. I just want to know. I'm unclear on this one. I will give you a pass on it, but you can go back 20 years. I mean, how far are you gonna go back?
Well, I can answer the question more specifically as to how far we can go back under normal circumstances. My experience has been with government agencies, you have a year, like a rolling 12 months. But with private pay, it depends on if people have expired or not, if estates are still open. If I remember right, the oldest collection account that I saw was 10 years old. And I couldn't tell you off the top of my head right now what particular payer source it was. So just to clarify, we're not without a plan. We're not without understanding how far we can go. We have to figure out exactly what is our actual situation when it comes to our aging. And then from there, we'll be able to clear up what we're owed from Medicare, Medicaid, managed care organizations, insurance companies, and what we're owed private pay. And there are a couple of different types of private pay balances that can be incurred. Some of them are related to people who are on Medicaid who have to contribute their monthly income to the facility. And there are some limitations on what we're able to do. In most cases, that's just bad debt.
And at that point, then, if there's things that we have to write off, then it would then go to finance then. Make the recommendation to finance as to what we would have to write off.
Yes, and Larry and I have already had just a preliminary conversation as to the fact that he knows of some options that are available that would allow us to go through that process of writing off bad debt without one particular fiscal year taking the whole hit. It's on paper. I'm not an accountant, so I ask for your forgiveness for that. I do understand a lot about it, but not to the extent that an accountant does. I just know that with his experience in this industry specifically, he will be a tremendous help to us when the time comes that we have identified bad debt and what's the best way to handle that.
Okay, thank you. Any other questions? All in favor? Aye. Any opposed? No. And that one is approved. And your last item is a request approval of a rehabilitation services agreement, skilled nursing facility with Cimbria Rehab Incorporated. Motion, Beer, second by Bell.
Cimbria is our current provider. They're actually just updating their services and some of their processes, and it had subsequent impact on the contract.
Any questions? Okay, all in favor? Aye. Any opposed? Okay, and that one's approved. Moving on to your monthly report on pages 84 through 88. Is there anything you want to highlight there?
Just a couple that we hit a couple of new milestones. First of all, we hit a percentage of 74 for our total referrals coming from local hospitals. So 74% of our referrals in the month of July were from our local hospitals, which has been a focus of ours. We're pleased with the turnover rate being at 47%. And census in July and August plateaued a bit, but that's common. And we anticipate that to make a move upward here in the months ahead to finish out the year.
Anyone have any questions? Okay, and then you have a impacted position. Did this go to finance yesterday?
It'll go to finance next Wednesday.
Next, oh, that's right. This is the first, yeah. Okay, so we'll go to finance on Wednesday. You want to say anything about that? Or?
So as I put in the memo, we found that there's hardly a position in our industry that is not difficult to fill. I don't know if that's grammatically correct or not, but that's how it came out anyway. In other words, they're all difficult to fill. And with changing wage rates in other industries that were competing for the same workforce, we found that recruitment was difficult, but then in August, we discovered that retention was difficult. To put things in perspective, in the month of August, we had 10 terminations when I just completed our turnover report for the month of August. 6 of those 10 were from these departments that we lost because they could take on similar jobs in similar industries at a rate that was higher than what we were able to pay them at the time. So we believe with the recommendations presented in this memo that it will put us in a position where our recruitment for food services, which by the way is highly competitive right now, and then also in environmental services, and ultimately in activities and social services for the assisted, but more so in food services and environmental services, it'll put us in a position where we will not only be able to get quality people, but retain them.
Okay, anybody have any questions? But it will align with the salary study that will be in the budget.
Thank you for
correct?
bringing that up,
So
yes.
It wouldn't be like somebody would get more money now and then have money taken away, or
That is correct.
That is correct, yes. Thank you for bringing that up.
I want to make sure that
I
that's
should have emphasized that, yeah.
clarified. Okay. And I think that's all, unless you have anything else you'd like to tell us about.
We appreciate you all. I want you to know that, and we appreciate your support. And I'm very grateful for the team that we have at the home, and we will press on.
Thank you. Next is Jessica McKnight, Health Department Administrator. We have a bunch of action items today. Wow.
Hello.
Hello. You have 2 items for action. First one is request to approve an ordinance by the McLean County Board amending Chapter 205 fees, Article 11 miscellaneous code fees in the McLean County Code for Chapter 216 food service on pages 90 through 94. I have a motion by Martin, second by Beer.
Do you want me to speak about it? The Board of Health has approved this to come here. This is the 3% normal increase that we typically include. So any questions, I'll be happy to try to answer.
Any questions? Okay, all in favor? Aye. Any opposed? Nope, okay. Excuse me. And the second item is request to approve ordinance by McLean County Board amending Chapter 205 fees, Article 11 miscellaneous code fees in the McLean County Code for Chapter 310 sewage disposal systems, water wells, and geothermal exchange systems. Motion by Beer, second by Bell. And this is our geothermal. And that, these were backwards in here. In my packet, that's, I was looking at the wrong thing. These are the geothermal goes up automatically 3% every time. So-
Yes,
And
unless-
both of these, this one and the one with the food fees for the last 2 years had been frozen. We had not raised them because of the COVID. So this is just back to our regular kind of fee. Any questions? All in favor? Aye. Any opposed? Okay. And both of those had passed the Board of Health last month, so. And you have your monthly report?
I do.
Anything you want to highlight on that?
Obviously, some updates since I submitted the report. We have reported our first confirmed monkeypox case, and case investigation, contact tracing were completed for the case, and we ensured any treatment or any vaccinations were provided as necessary. And I've been mentioning now, I think probably for 2 months, about once we were not able to order vaccine until we have a case. Now we have a case. So we will be looking to order vaccine and provide as appropriate to eligible individuals. Just wanting to make sure that everyone's aware that mass vaccination for the public at large is not recommended right now for monkeypox. So again, we're planning to expand the eligibility from just close contacts to high-risk individuals, but we'll have more information about that soon.
And the state is kind of being the one now, instead of, with COVID, instead of us reporting a lot of stuff and doing things, it's going to be the state all going through IDPH, correct?
Yes, yeah, I included information in my report about IDPH's site. So they are including by county a breakdown of monkeypox cases and demographics for the cases from the entire state.
Any other questions? Anything else you want?
In Texas,
go
we've
ahead.
had our first death from monkeypox. In Texas, a man died of monkeypox. We had the first confirmed case. So this is pretty serious. It's not, get a shot or something. It's serious.
Yeah, I think reports for the first potentially monkeypox-related death, the individual was severely immunocompromised. So, CDC says that most individuals can even just remain at home for isolation. Hospitalization for monkeypox is very, very, very rare.
Anything else? Anything else you want to say about your report?
Nope, unless there's any other questions about other items in it.
Okay, thank you.
All right.
Next is Cassie Taylor, County Administrator.
Thank you, Chair Schaefer. I have no items for action tonight, but I do have an item on your agenda to be presented for information, and that is a collaboration that we are hoping to be a part of. We'll be presenting this to the Executive Committee as this deals with ARPA funding. But we have a opportunity to be a part of a larger group that is coordinated to provide a funding to Carl Hospital for a mobile health clinic bus. And this would not replace the bus that we are providing for our health department. It would be in conjunction to that. And so we feel that the Public Health Department, with their efforts, there will be times when they could coordinate with the larger services provided through the mobile health clinic bus. And so we will be asking the Executive Committee if they would like to contribute $100,000 of the ARPA funding towards that project. That I think is $750,000 in total.
Any questions for the County Administrator? Okay, under Other Business and Communication, our next meeting is October 6th at 5:30. And we have, anybody else have any other business or communication? I would like to put a plug in for our Community Mental Health Forum, which will be on October 4th, all day, from 8 till 4:15, I believe. We have some really awesome sessions planned. I'm on the planning committee, and think there's a lot of different variety of topics that people can find something of interest, and they don't have to be there all day. It's free, and there's free parking, courtesy the town of Normal and their parking garage. So I hope I see you all out there. Pardon? Oh, yeah, yeah, because there'll be registration that'll come out and stuff like that, because we just want to keep track of, how many people sign up, just so we have an idea how many are going to attend. And I think lunches, if you want a lunch, there'll be a small fee for that, but you have to do that through registration. Otherwise, you could, find something in Uptown Normal if you want to have something outside of that.
CEUs are also available for a nominal fee.
Yes, CEUs, yeah. So if you have people that need CEUs. Okay, we have bills to pay, and the auditor has reviewed them all, and they comply with all of our ordinances, resolutions, and policies. First up is the Board of Health has a prepaid total of $271,990.39. Motion by Beer, second by Bell. All in favor? Aye. Any opposed? Okay. JDC and Jail Medical have a prepaid total of $132,187.16. Motion by Martin, second by Beer. He was faster than you were. All in favor? Aye. Any opposed? Okay. Developmental Disabilities Board has a prepaid total of $69,728.69. Motion by Beer, second by Bell. All in favor? Aye. Aye. Any opposed? Okay. And the nursing home is a prepaid total of $660,798.34. Motion by Beer, second by Martin. All in favor? Aye. And I believe that is it after we've paid all of our bills. So this meeting is adjourned. Thank you.